Okay, so we're gonna be looking at assessing Addison's lungs today. So first I'll be looking at Addie's chest, and you can just kind of sit up straight for me, and assessing A to P as well as lateral dimensions, making sure that he's wider side to side than he is back to front. And then we'll be looking at assessing the trachea, making sure it's where it should be, going straight up, straight down, no deviation there. I'll also be looking at his lips and his fingernails for signs of cyanosis, looking for color and any clubbing of the fingernails as well. And then just while we're doing this, also assessing the rate, the effort, the rhythm, and depth of Addison's breathing, making sure that that's normal and within limits. And you appear normal and healthy so far. If we were actually doing this assessment, it would probably be good to have the patient gowned up or with, so we can get on bare skin, but we'll just pretend he's in a gown right now. So first we'll be assessing chest expansion. So first I'll be doing, there you go, thank you. We'll be doing lateral chest expansion. So I'll be coming on about 7th intercostal, and I'll be having you take a breath in. Good, making sure that those are expanding symmetrically, as well as then hand on sternum and posterior thoracic back here, and making sure A to P, his chest is expanding with his breath. Then I'm going to have Addison cross his arms and flex forward for me to move the scapula out of the way. And then I'm going to be assessing tactile fremitus. So we'll put the lovely stethoscope in, and I'm gonna go down your spine, and I'm gonna have you say 99 for me.
99, 99, 99, 99, 99, 99, 99.
Good, and that sounds good and normal. And then we'll be percussing down the spine, so we'll just be going down both sides of the spine, kind of overlapping from side to side, working our way down. And I could also do that in the front and lateral sides if I wanted to, and suspected some problems with that. He's pretty healthy though, so we'll kind of leave that for now. And then auscultation. So I'm going to instruct the patient to take slightly deeper breaths than you normally would for these. And I'm just going to be assessing breath, just breathing in as we go down. So go ahead. Good. And we would want to do that laterally, posteriorly, as well as anteriorly in the front too. And then if we were suspecting some problems with something, we would go on to do bronchophony, egophony, and whispered pectoriloquy. So we'll start with bronchophony. So I'm going to, I'll be curious if there's a problem up in the upper quadrant lung field. So for bronchophony, I'm going to instruct the patient to say Scooby-Doo every time I move with stethoscope. So go ahead.
Scooby-Doo, Scooby-Doo, Scooby-Doo,
Good.
Scooby-Doo, Scooby-Doo, Scooby-Doo.
Good, and I'll be doing that on both sides, comparing that, making sure that appears normal in that area. And then we'll do egophony. So I'll have the patient say E every time I move it.
E, 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 E.
Good, and making sure that sounds equal bilaterally. And then we'll do whispered pectoriloquy. So I'll just have you whisper for me, Blue Moon. Are you whispering?
Yep.
Good, and those sound normal. So I'd say you're pretty healthy.